Health Watch is presented by UMass Memorial Healthcare. Here, caring for you.
Welcome to Health Watch, presented by UMass Memorial Healthcare. With the spring and summer weather now, more people are going outside and going for a run. Whether you're experienced or a beginner, there are some running injuries you need to watch out for. What are some injuries commonly associated with runners?
So usually with runners we see either pain, most likely it's going to be in their knee, either in the front of their knee or the side of their knee, or it's going to be in their lower leg and foot where they'll have shin splints in the front of their shin, pain in the heel, which is plantar fasciitis, and pain in the back of the heel, which would be more Achilles tendonitis.
How can physical therapy help with running injuries?
It really depends on the stage that they come to us in. You know, obviously we prefer them to be in as soon as possible. They're much easier to control. We can work on soft tissue, massage, releasing of any tight muscles associated with the pain, whether it's the Achilles tendon or the IT band. You know, sometimes we do functional movement screens where we have to work on what the cause of the pain is. Just because the pain's in the side of the knee doesn't mean that it's actually coming from that area that's causing the problem.
How important is it for someone with an injury to get treatment early?
We can treat it at all stages. It's much easier to cure, to fix at the early stages. If they come in when it's more acute, meaning that they've had it for less than a month, then it's much easier for to recover. It's much quicker recovery. You get back to running a lot quicker, and you don't take as much time off. Chronic pain obviously usually entails a lot more exercise, a lot more retraining, a lot more time, and usually for runners, unfortunately for them who are manic about how often they run, it's a lot more time away from running, which is what is the hardest part for them when they're consistent.
If you're a runner, what can you do to prevent injuries?
Ideal way for them to prevent injuries is to incorporate into their running programs actually exercises that aren't running. Exercises that are going to exploit their weaknesses biomechanically, exercises that are going to alleviate the stresses of running, whether it's stretching exercises through yoga or Pilates type core exercises, or just lower body strengthening and stabilization exercises to prevent any imbalances that they have functionally that they're exploiting or overusing when they go through the fatigue of running longer distances or longer time.
How important is sneaker selection?
For the majority of us, sneaker selection is very important. They have high-tech sneakers that are really geared at correcting our inefficiencies in terms of biomechanics, and that they can, the sneakers can actually improve on our fault in our biomechanics, so we won't overpronate or over-rotate our feet or hips, and thus putting less stress on the knee. Some people get hung up on shoe type based on their type of foot pattern, and realistically it also has to play a role in how your foot translates into the way you run or the way you walk. And so you want to make sure that you're at a store that's evaluating not only your foot type but also one that is evaluating the way in which you do the exercise. Most physical therapists are educated in the physics of running or the physics of walking and running so that they can help make that decision for you and give recommendations to you that you can bring to any shoe store.
Does weather play a factor in running injuries?
Science shows that it's not supposed to happen. If you talk to someone with arthritis, they tell you it does happen. But we do see obviously more running injuries or overuse injuries in the summertime because people are outside having fun.
What is your best advice for a beginner runner?
My best advice to new runners is that walking and running is the best way to start. Don't just start running every day and feeling like that you can't walk or you're a failure if you walk. It's actually better to ease into a program where when you start out it's a combination of walking and running, and that you progress more time running and less time walking as your first goal. And then after that, the second most important thing is try not to do it 2 days in a row. Always leave a day for full recovery. Your muscles are doing something that's new to you. There's going to be some wear and tear on those joints, and they have that extra recovery day will allow you to build strength more efficiently and also to prevent overuse injuries. The other thing I would really suggest to anyone, whether they're a new runner or someone who's been doing it for a long time, and is that when you start any program of exercise, that it's a comprehensive program. It involves not just running, not just doing running or walking as your primary mode of exercise, but incorporating some other strengthening exercises, some other core stability exercises, things that are going to exploit your weaknesses so that you don't end up with overuse injuries, so that running or walking or the combination of both becomes a lifelong sport for you.